Before 1937, Americans were able to freely buy, sell, grow, and smoke marijuana. In 1970, marijuana was classified as a Schedule I drug, which means it has no medical benefits, is dangerous, and addictive. Marijuana studies have been very limited for decades ever since because it's illegal to possess. However, some states have begun to legalize marijuana in the last few years, even though it is still illegal on the federal level. Legalization at the state level has allowed some studies to begin and have shown that marijuana does indeed have medicinal benefits and is safer than alcohol or opioids. It also has economic benefits as well. Carl Hart, a professor of psychology at Columbia University and author of the book High Price, once wrote, "Perhaps it's also a joke that law enforcement agency has the final word on a medicinal issue." Professor Hart also, despite regulatory barriers, has engaged in research on the benefits of marijuana and has found that marijuana stimulates appetite in HIV patients and also beneficial for neuropathic pain, spasticity caused by multiple sclerosis, and chronic pain. THC, one of the main cannabinoids derived from marijuana, has been recognized to have anti-cancer effects. Some cannabinoids are better at killing cancer cells, while others are best for slowing cancer cells. Plus, they do not attack cells in ways that chemotherapy and radiation can, which also leads to hair loss sometimes. Noel Crom, a writer for the Oregonian newspaper in Portland, Oregon, once wrote that alcohol use is a factor in 40% of all violent crimes in the United States, including 37% of rapes and 27% of aggravated assaults. Each year, 1,800 college students will die from accidents related to alcohol. Another 400,000 will have unprotected sex, and another 100,000 will not even be able to remember if they consented because they were too drunk to remember. In 1996, annual opioid usage was 73 milligrams per person. By 2006, those numbers rose to 329 milligrams per person. That's an increase of 4.5 times over a 10-year period, usually starting as a prescription for pain and then sometimes turn into a powerful addiction that leads to more drugs like methamphetamine, methadone, or heroin. This has become an epidemic in the United States. While marijuana may have some health issues of its own, it will not cause you to have an overdose. Jenny Graves, a writer for Prevention Magazine, revealed in July of 2016 that a study at the University of Michigan found that medical marijuana patients reported 64% reduction in opioid use. Another study published in the Journal of American Medical Association has shown that opioid overdoses have dropped as much as 25% in states where marijuana is now legal. The potential for dependency isn't as strong as the other drugs either. The National Institute Drug Abuse shows that 30% of marijuana users have some degree of use disorder. To say marijuana isn't the end all for the drug epidemic would be ridiculous. On the other hand, though, to treat it as it has no medical benefits and doesn't help with other dependencies like alcohol and opioids would be devastating to the many patients who already experienced the benefits of medical marijuana. One of the biggest issues we face with legalizing marijuana is the taxation and how it can benefit the economy. Since Colorado was one of the first states to legalize marijuana, they've already figured a lot of this out. In 2014, Colorado reported a sales tax from their marijuana at $67 million. In 2018, only 4 years later, those numbers nearly doubled to $130 million. In 2015, Governor John Hickenlooper told USA Today that the people who were smoking marijuana before are still smoking marijuana. Now they're paying taxes. Colorado has also taken some of their new tax revenue and invested it in building and affordable housing programs for the homeless people. Pueblo County, Colorado has taken its cannabis dollars and used it for college scholarships and public enhancement projects. There's literally nothing that you can do that's not already taxed. Whether you're for more taxes or against it, the fact is it funds road constructions, government programs and hospitals, and also schools. The legalization of marijuana, whether it be for recreational or medicinal use, creates jobs also. The people that work in these jobs pay income tax and they spend their paychecks on the goods they buy, which sequentially boosts the economy. Legalizing marijuana isn't going to fix every problem in the world that we have today. It's already been shown that cannabis has medical benefits for patients, and it also helps alcohol and opiate addicts. Legalization of marijuana doesn't come without its cons either. Since it's illegal on the federal level still, employers can do pre-employment drug testing, and this can prevent people from gaining employment in states where marijuana is not yet legal. Marijuana also has psychotic effects on some users and carry a dependency of its own. Operating machines or operating automobiles would not be a smart thing to do. Ongoing cannabis use, especially in teens, has been linked to memory loss and anxiety. Then there comes the use of regulation and how do we keep teens from buying it. In the states where it's already illegal or legal, you have to be 21 years of age to buy it. That still doesn't keep teenagers from getting their hands on it. So the question is, for us Americans and legislators, do we legalize marijuana, and if so, how do we regulate it and keep it safe?